Hey, this is Erin from Educated Nurse, and I'm doing a lecture series on what it was like to go from an ER nurse to a breast cancer patient and back again. Number 8's lecture is on tamoxifen, which is an endocrine therapy. Not everybody is on this, but this is something that I was on because I was premenopausal when I was diagnosed with breast cancer. Patients that are menopausal will likely be on an aromatase inhibitor. And again, everybody is different, and you need to work with your doctor to figure out what works for you. This is my experience on tamoxifen. I do want to put a disclaimer out there that this video is for instructional purposes only. The information shared is my story, and it's not everybody's story. None of the information shared should be considered expert medical advice. The information presented should not replace the information provided by your doctor. Please work with your own doctor to find the best course of treatment for you for your situation. Also, I will use medical terminology which may not be suitable for children. And please also be aware that I'm very honest. I tell it how it is. I don't sugarcoat, and for that I apologize for the occasional profanity. All right, so let's talk about tamoxifen. My cancer was estrogen and progesterone positive, which means those hormones fed my tumors and made them grow. After all was said and done, chemo, surgery, radiation, I still needed medication to suppress my hormones. My oncologist started me on tamoxifen. The plan was 5 years of therapy, but new research showed success with 10 years. I'm now at 8 years and I'm still on it. When I first started, I was pretty miserable, but eventually, as with everything else, it got better. So I'm going to talk a little bit about side effects here and some tips about this. I recently saw my oncologist being at the 8-year mark, and he said, if you're tolerating this, there's evidence to show to stay on it longer. We'll see. I definitely feel better when I'm off of it, but I feel like with cancer, this is the one thing I have control over. This is the one thing that I can do to help prevent it from ever coming back again. So I personally have made the decision to deal with the side effects and continue to take it, even though I don't feel good on it. But like I said, this is the one piece of control I have. And I know personally I would feel guilty if there was something that I could be doing to help prevent it, and I didn't. Not everybody feels that way. Some people are absolutely miserable, so it's up to you to decide what's best for you. So, side effects of tamoxifen. Nausea. At the beginning, I was pretty miserable and I had no appetite. Most people gain weight on tamoxifen, but I lost weight because I was so nauseous. I ended up taking it before bed, and then I didn't really notice the nausea anymore, so that helped. Night sweats. So tamoxifen suppresses your hormones and basically puts you into a chemically induced menopause. So I was having night sweats and hot flashes, and I would get up multiple times per night just kind of sweaty and lying in a pool of wet bed sheets. I did a lot of laundry in the beginning. And I never really found a trick to make it better. It just got better over time, to be honest. With the hot flashes, I wasn't really ready for that, and hot flashes kind of came at the worst times. So working as an ER nurse, I remember we got a trauma one day, and we kept our trauma rooms at 70 degrees. But with 15 plus bodies in there, the temperature was rising even more, and I was having bad hot flashes. I got lightheaded and I passed out. It was bad. For the most part, I felt my hot flashes around the time I needed to take my next dose. So to help me not have as many during the day, again, I started taking my tamoxifen at bedtime. In the beginning, this caused a major emotional roller coaster being on this tamoxifen. I was a mega bitch. 1 minute I was happy, the next I was sad and crying, the next I was pissed off. It was bad for a few weeks. And my oncologist, I actually started recommending I start taking Effexor to help with the hot flashes and the emotional side of things. In the beginning, I didn't take it. I didn't want to have one more medication, not one more. I ended up going to see my therapist every week to talk through some of my irrational thoughts, and she helped me with kind of my emotions and sifting through things. Eventually, I started taking it, and I wish I would have a little bit sooner. It's not for everybody, but again, it helped me. One of the worst things about tamoxifen is the fatigue and the muscle and joint pain. Joint pain is common, but my hips would get so stiff in the morning when I got up. Moving around and stretching helped a little bit heating pad helped too. But I would just felt so dang tired and weak all the time. And then I'd get these like really terrible muscle cramps. I'd get the most excruciating cramps in my calves, mostly in the middle of the night, kind of like Charlie horses. I started taking ibuprofen, but that didn't help. And I actually found out through my support group that people had success taking magnesium and calcium. I tried taking magnesium, and within 2 days, my muscle cramps went away completely. The fatigue and the brain fog are ongoing and continued problems. And again, I have just decided for myself that I am willing to feel miserable because I'm feeling like it's helping. I'm feeling like it's doing something. The other thing that's important with tamoxifen is that it does put you at a higher risk for clots. So you have to talk with your doc about maybe starting a blood thinner or a baby aspirin or something. And again, everybody is different. So a tip for this, you have to determine if the side effects are worth your sanity, happiness, and health. I was miserable for a while, but I kept telling myself, whatever I need to do so this freaking cancer doesn't return, I'm going to do it. There are very serious side effects associated with this med, so it's important that you talk with your doctor about managing everything. And if it's not working for you, find something else, or maybe it just isn't going to work for you, and that's okay. But you need to make that decision for yourself. If you want to learn more, check out my book. I wrote this while I was going through cancer treatment as kind of for a way for me to process things. And I found afterwards that it actually could help other people. So my book actually goes into a lot more details about my journey and just some tips and tricks that I learned along the way. You can check it out. It's available on Etsy, in my Etsy shop, and on Amazon. Thanks for listening, and make sure to check out the other videos in this series.